In the state of Alaska, we joined 6 other states in the country in declaring a public health crisis in response to the opioid epidemic.
The Walker administration issued a public health disaster declaration stemming from opioid abuse.
Our very rural communities are predominantly Alaska Native communities. They're being devastated by substance abuse and now opioids. The rate of overdose deaths attributed to opioids have increased and in many cases has greatly exceeded the national average.
Heroin is on the rise. Alaska is not left out of the national trend.
Heroin is increasingly available, it's increasingly cheap.
In 2012, our prescription opioid pain reliever overdose death was more than double the national average, and our heroin-associated overdose deaths was over 50% higher than the national rate. And the overdose death rate by race was the highest amongst Alaska Native people, so our statistics are just troubling to the core. We clearly have an opioid epidemic, Mr. Chairman, and we must deal with it, but I must say that we must not lose sight of the other killer that we are facing in our Native communities, not only in Alaska, but around the country, and that killer is alcohol, and how alcohol has wrought devastation.
The Murkowski tribe passed a resolution this week asking the governor to declare a state of emergency. He did last year for the opioid crisis in Alaska, but people in Murkowski say the alcohol epidemic is worse. 5 of the 400 who live there have died because of alcohol they bought in Bethel.
It is just yet one more reminder to me that when we think about those who we serve and the cries for help that they are asking us for, we have so very much to do.